Hello everyone, welcome to Atozbodyform, where today we talk about 10 kidney warning signs not to ignore if you want to stay healthy longer. Let's get started. Sign number 10 is change in urine color. If your urine suddenly turns darker, it's a sign that you may have high blood pressure. You might notice darkening of both your urine and stool. High blood pressure, if left untreated, can lead to kidney damage or failure, so seeing a doctor is important if you notice changes in your urine color. If your kidneys are failing, they won't be able to remove waste products and excess fluids from your body. As a result, waste product builds up in your bloodstream and gets filtered out by your kidneys into your urine. This will cause an orange-brown discoloration due to higher concentrations of urea called uremic poisoning. However, if you're just dehydrated, then it's likely that your urine will turn a darker shade of yellow rather than brown. So keep an eye on your urine's color to help identify any potential health problems. In general, clear to pale yellow urine indicates good hydration levels. Cloudy or greenish yellow urine means you need more water. Pinkish red means too much protein in your diet. Deep red means too much iron. And purple means a vitamin B12 deficiency. Sign number 9 is pain while urinating. This is one of the most common symptoms of a problem with your kidneys, and it can be caused by a variety of things. Pain while urinating can be felt as either a mild ache or an intense pain in your lower back, pelvis, urethra, the tube that connects your bladder to your genitals. No matter how you experience it, pain during urination should always signal cause for concern because it could mean damage has been done to a part of your urinary tract. This damage could be as simple as inflammation or irritation from infection or something more serious like blood clots or narrowing of arteries. There are many causes of painful urination, so if you're experiencing pain when weeing, it's important to see a doctor immediately. The sooner you get treatment, the better off you'll be. When seeking medical attention for issues related to your kidneys, it's also important to keep track of all associated symptoms, even seemingly unrelated ones, so that doctors have a complete picture of what's going on inside your body. Sign number 8 is frequent urge to urinate. If you're frequently finding yourself needing to use the bathroom, especially at night, that could be a sign of an underlying problem. When your kidneys aren't functioning as they should, they produce a hormone called renin, which prompts your body to expel excess fluids through urination. Since your kidneys are unable to perform their duties properly when they're damaged or diseased, you may end up weeing more than usual in order for them to work normally. Also keep in mind that certain medications can lead to frequent urination. So it's best for you and your doctor if you let him know about any new drugs or supplements you may have started taking recently. Sign number 7 is itchy skin rash. If you're itching, that may be your kidneys trying to warn you that something is wrong. A rare but sometimes fatal condition known as Goodpasture syndrome can cause an itchy rash in addition to joint pain and shortness of breath. The disease usually occurs after a person has been sick with an other illness or infection, such as pneumonia or chickenpox. It also can occur after taking certain medications or getting a tattoo. Kidney problems also can cause itchiness around your genitals, feet and hands, especially at night when you're lying down. The medical term for itchiness caused by kidney disease is pruritus. That Latin word means itching or scratching desire. Pruritus often occurs in people who have advanced kidney disease, although symptoms vary from one person to another. Pruritus is most common among people with end-stage renal disease, ESRD, which is when your kidneys no longer work well enough to keep waste products out of your blood. Your doctor will check for ESRD if you have unexplained itchiness or other skin changes that don't go away on their own. Even if you don't have ESRD, check with your doctor if itching seems like more than just dry skin or an allergic reaction to soaps or detergents. Your doctor might suggest changing soaps and detergents, bathing less often, and using moisturizers on areas affected by itching. Sign number 6 is weight loss. Kidney disease is a very serious thing, but it's also one of those things that people don't always talk about. Your kidneys are responsible for filtering out waste and toxins from your blood, which is why there are often symptoms associated with damaged kidneys. The symptom may be ignored because they seem unrelated to your kidneys, but that's exactly why you should call your doctor if you experience them. If you notice them happening over time, go ahead and schedule an appointment right away so you can prevent any damage. Sign number 5 is tiredness or fatigue. Kidney disease can be like a thief in your body. It may come on gradually and insidiously, quite robbing you of energy, stamina, and strength. Feeling tired or fatigued is one of many early warning signs that can indicate a serious underlying problem with your kidneys, so it's important to be aware of your symptoms. If you feel more fatigued than usual for a few days in a row, ask yourself if you might have another health issue causing it, such as anemia, thyroid disease, or sleep apnea before jumping to conclusions about your kidneys. Also pay attention to how long your fatigue lasts. Tiredness that lingers for weeks at a time could be a sign of other issues such as depression or heart problems, which could also lead to shortness of breath and palpitations. Sign number 4 is nausea and vomiting. If you're feeling nauseous or vomiting, it could be a sign of an infection. This can happen with acute kidney injury too. The nausea and vomiting could make your urination more frequent as well. If it goes on for a while and you're not pregnant, it's time to get help from your doctor. In many cases, infections in your urinary tract are caused by bacteria that can easily be treated with antibiotics. Depending on what antibiotic your doctor prescribes for you will depend on how long treatment lasts. 5 days is common, 10 days is less so. Sign number 3 is abdominal swelling. Swelling in your abdomen may be a sign of fluid accumulation due to kidney disease. Swelling in your abdomen can make it hard for you to stand up straight or have a full breath, so be sure that if you're experiencing any symptoms of swelling, you let your doctor know right away. If your kidneys aren't functioning properly, excess fluids will flow into other areas of your body instead. Abdominal swelling can occur on both sides and near or under one of your ribs or in a V shape along the midline of your body. The swelling is often described as feeling like a bag of worms beneath your skin. It may feel worse when you're lying down than when you're standing up, which is why many people attribute their swollen belly to eating too much while they sleep. Sign number 2 is severe dizziness. Dizziness can be a sign of several things. It's usually caused by a change in blood pressure or blood flow, but it can also be caused by dehydration, overheating, or certain medications. If your dizziness is severe and accompanied by weakness, numbness, or nausea, get it checked out immediately. In some cases, doctors may need to run tests on your kidneys as well. Severe dizziness could mean that your kidneys are starting to fail. A simple urine test could determine whether that's true or not. Sign number 1, and the most important sign of all, is fever. While a simple fever isn't an immediate cause for concern, fever combined with other symptoms can be a red flag. If you have a chronic illness, talk to your doctor about how much and what kind of fever you should seek medical attention for. In most cases, if you have a temperature that's 100 degrees or higher, rectal, and other flu-like symptoms like chills, fatigue, body aches, and headaches that accompany it, go see your doctor immediately. While home remedies are great for many things, in this case it might be best to see your doc. The same goes for very high fevers that last more than 3 days. Even if you don't experience any additional symptoms, make sure to see your doctor. A prolonged high fever could lead to dehydration and organ damage. Many people have no idea what their kidneys do, or they're unsure if they have a problem with them. But paying attention to these 10 warning signs can help you determine if something is wrong with your kidneys. If you notice any of these symptoms, schedule an appointment with your doctor as soon as possible. Chances are good that he or she will find nothing wrong, but it's still better to be safe than sorry. Your health depends on it. We hope you enjoyed learning about 10 kidney warning signs not to ignore. If you have any questions, please feel free to comment below. We will get back to you as soon as possible. As always, we wish you good health